Hi.
Hi, Julie.
Yeah.
I'm Sarah. I'm going to be your PA student today.
Hi, nice to meet
I'm
you.
just going to take a history. So, how are you feeling today?
I'm okay.
Okay. What brought you in?
Oh, I'm having this really, really bad abdominal pain.
Abdominal pain. And how long has that been going on?
I would say maybe like 4 months.
Oh, okay. Wow. I'm sorry that that's happening for you, but we're going to try and figure it out. Can you point to it with one finger where the pain is hurting you?
I would say it's middle, definitely stomach area.
In the middle? Okay. And then, was it a gradual or sudden onset?
I would say it's gradual.
Gradual.
It wasn't sudden.
All right. And were you doing anything when this stomach pain started?
No, not that I know of. It was kind of like, it was like a stomach pain and I was like ignoring it and then it's just like gotten worse.
Okay. Has anything that you've noticed made it better or worse?
No.
Nothing? Does it ever go away or is it just constantly?
I would say it's pretty constant.
Okay. And can you describe it? Is it dull, aching, sharp?
Definitely aching.
Definitely aching, okay.
A little bit of sharp, but I would say it's more aching.
All right. Could you tell me, is it sharp after you eat a meal or depending on the position you're in?
I would say it's not necessarily in terms of like what I'm eating. It's more like just like all day, and it's difficult falling asleep at night because of the pain.
Okay. Yeah, we definitely want to figure out what that is then. Have you ever experienced anything like this before?
No, I've had like stomach issues, like if you eat too much, you feel cold, but this
Yeah.
is not like that.
Okay. So would you say it's worse than a stomach flu? About the same?
Worse.
Worse. All right. And then, does your pain go anywhere else other than the center of your abdomen?
No, it just stays there.
No? Okay. And then, on a scale of 1 to 10, 10 being the worst pain you've ever felt, how would you rate this pain?
I would say around a 7.
Okay. And then, is there any time that it's better or worse?
I would say initially, at the beginning of this 4-month time period, I would say it was around a 2, next month 3, 4, next month 5, 6, this month it's
so
7.
Definitely gradual. Yeah. And then you said that this is a constant pain, it doesn't really ever go away.
Yeah, it doesn't go away, and it just is getting worse.
Okay, and how has that been affecting your life, if at all?
I mean, originally it wasn't. I just was kind of ignoring it, and now it just seems to be affecting me, so I came in.
Okay. Do you have any other symptoms that you find go along with your stomach pain?
My stool has been a little bit weird. It's darker than normal, like a tarry color.
Have you ever got tested for any blood in your stool or anything?
No, I have not.
And how long have you noticed your stool's been a little off?
In the past week.
Past week, all right. And then, have you changed your diet or anything based off your stomach pain?
No, I'm trying to eat 3 meals a day still, but it's just like the stomach pain is so bad, like you don't want to eat when your stomach hurts.
That's understandable. I get that. And then, have you ever experienced any change in your stool like this before?
No.
No,
I would say no. I mean, I'm not like constipated or have diarrhea or anything. It's like pretty normal in terms of like mass of it.
Okay.
It's just a weird color.
And then, is it also typical in your bowel movements? How many times would you say?
I would say once a day.
Okay. And then, are there any medications that you're currently on?
I'm on the NuvaRing, birth control.
Okay. And how long have you had that?
A year.
Okay. And anything else that you can remember?
I take an albuterol inhaler for exercise, but I'm not really compliant with that.
All right.
And then before the NuvaRing, I was on like a pill form of birth control for a couple years, stopped it for like a year, and then went on the NuvaRing.
Okay. And do you happen to remember what that name was? That's fine.
I think it was very generic, mild dosage.
Okay, that's fine. I can look that up later then.
Okay, cool. I'm sorry about that.
That's okay. So just getting into some of the questions more related to your symptoms.
Okay.
Could you tell me your usual weight?
140.
And then have you experienced any recent weight change with this illness or beforehand?
No, my clothes maybe fit a little bit more looser just because my snacking habits and eating habits hasn't been as regular.
Okay.
But I mean, besides that, no like drastic weight changes.
Okay,
No.
so nothing drastic. How about any weakness, fatigue, or fever?
I would say like fatigue and weakness because of this chronic stomach pain.
Okay.
So like because I'm in pain, I'm getting this like really bad like weakness and like less strength, and it's harder falling asleep at night. But no fever. I haven't taken my temperature.
Okay. That's good to know. So then would you say the weakness started immediately with the stomach pain, or was it kind of a little bit later?
I would say it goes as the stomach pain has progressed. So like as I've gotten worse stomach pain, I've gotten more weak and more loss of energy.
Okay. And then how about, do you go to the dentist?
Yeah, I do go to the dentist.
Sure. And then do you know when your last dental exam was?
6 months ago.
All right. And do you experience sore tongue, sore throat, any hoarseness or anything?
No.
Okay. And none of that came along with this?
No.
Sure. How about, do you have any heart troubles? Like high blood pressure, rheumatic fever, murmurs?
No.
And how about any chest pain?
No, it's more just in the stomach.
Just in the stomach? Okay. Have you experienced any shortness of breath?
Not really.
Okay. And then, so when you do eat, I know it's a little bit less, but do you have any trouble swallowing?
No trouble swallowing. More trouble feeling that I'm gonna not keep it down.
Yeah. Okay. So then, would you say you get nauseous? Have you ever vomited from this?
I've never vomited, but
Okay.
I do have this nauseous feeling like I'm gonna vomit.
Okay. And can you tell me, does that last all day, or when does this come and go?
I would say it gets worse around meals.
Worse around meals? Okay. And and this just started with the pain, correct?
Yeah. In the same gradual process.
Okay. Have you had any heartburn?
No.
And we talked about your stool a little bit earlier, but are you aware of any hemorrhoids?
Not aware.
And you said you're not constipated,
Nope.
no diarrhea.
Nope.
Have you found a food that you can't eat with your stomach pain?
No.
Have you been eating anything more regularly than you would have?
No. I try to eat healthy,
Okay,
but I'm not vegan or anything like that.
sure. And then, have you noticed any jaundice, so yellowing of your skin? No. Any liver or gallbladder issues?
No, not that I know of.
And are you aware of any hepatitis?
Nope.
Okay. And then, just a couple more questions
Okay.
for you. Do you have any muscle or joint pain from this illness?
Not from this illness, but I do get headaches. I don't
Okay.
know if that has to do anything with it, but I take a lot of ibuprofen. My mom always warns me against taking it so much,
Sure.
but
All right. And then, how many would you say you take at a time?
I take 2 at a time,
2 at a time. And how often do you get these headaches?
2 or 3 times a week.
Okay. Have you ever talked to another provider about this?
I have, and they just made sure that if the ibuprofen helps, then I'm fine, which
Okay.
it does, so I haven't gone back.
All right. Okay, that's good to know. Have you noticed any stiffness in any of your joints, backache, gout?
Nope,
How about arthritis?
nope.
Any swelling, redness, or pain?
Definitely the pain, no visible redness, but there's definitely swelling down here.
Okay. And then, when did that start?
I would say the really bad swelling has started in the past 2 weeks, and that's what's been concerning.
Okay. So another reason why you came in today?
Right.
All right. And have you had any recent traumas or a history of trauma to your abdominal area?
No.
No trauma. And then how about any lower back pain?
Nope.
And then we talked about weight loss. Any chills or night sweats?
Nope.
Or rashes?
Nope.
Okay. So then, I know you said the NuvaRing and ibuprofen when needed. Are you on any other medications?
Nope.
And how about any allergies to medicines, foods, environment?
Nope.
Nothing like that?
Nope.
All right, so I'm going to get into your past medical history. So it's going to be childhood up until this point. So I know childhood, you might not remember everything, but just let me know to the best of your ability.
Okay, cool.
So in your childhood, did you ever have any major illnesses that you remember?
I don't remember it, but my mom said I had pneumonia when I was 2, so that'd be in 1998.
Okay. And then how about measles, mumps, rubella?
Nope.
Chickenpox ever?
Nope.
Rheumatic fever or scarlet fever?
Nope.
Nope, none of that. How about polio or any psychiatric disorders that you know of?
Nope.
No? Oh, all right. So you had like a relatively healthy childhood.
Yeah.
Just a couple times. Did you get your childhood immunizations such as flu shots, MMR, varicella, all of those? So then, as an adult, are you aware of any psychiatric illnesses that you may have?
Nope.
How about diabetes, hypertension?
Nope.
Hepatitis?
Nope.
Asthma?
Nope.
How about any...
well, I do have asthma because I have exercise-induced asthma, but it's not
that's right.
as...
I'm sorry, you did mention that earlier.
It's okay. It's just not as,
Yeah. When did that start?
I would say in high school, maybe like 2011, 2012, when I was really like at the heart of like my sports seasons.
Sure.
It was bad.
What sports did you play?
I played soccer, softball, and I swam.
Oh, nice. Good way to stay busy.
Yeah.
What do you do for your asthma?
So it's mainly when I run, I really like have to take it. But if I'm doing like weightlifting or anything like that, I don't need to take it. But I'm like not really that compliant.
The inhaler?
Yes,
sure.
The inhaler.
And have you ever had any complications from your asthma?
Nope, no asthma attacks.
Nope. All right. That's good. How about any accidents or injuries? Childhood, adult?
Nope.
Nope. Nothing.
No broken bones. Nothing.
And any surgeries or hospitalizations?
Nope.
All right. And then, are you up to date on all of your vaccines as far as you know of?
Yes.
Okay. So, like the flu shot, hepatitis B, zoster.
I don't think so. I don't.
Okay. And have you gotten a pneumonia shot?
I don't think so.
All right. So I want to get a little bit into some personal questions about women's health.
Okay.
So just let me know if you feel uncomfortable at all. We can stop and discuss something else. So when was the date of your first period or age?
I would say probably 14.
Okay. And then is it typical or how would you describe your period?
It's typical. I get it once a month.
Once a month. And how long does that last?
5 to 7 days.
And is it light flow, medium flow, heavy?
Heavy.
Okay. Do you have any cramps with that?
Yeah.
You do? And are they manageable or do you take anything for them?
I take ibuprofen.
Okay. And when was your last period?
2 weeks ago.
All right. So have you gotten a pap smear done or a mammogram at all?
Yeah, I've had a pap smear. Haven't had a mammogram or like a...
Okay. Are you planning to get that then when
yes.
you come to that age? And could you tell me when your last pap smear and exam were?
6 months ago.
Okay. And any history of pregnancies?
Nope.
And then a couple more personal questions.
Okay.
Are you currently, or have you ever been sexually active?
Yes, not currently, but I have been.
With men, women, or both?
With men.
Okay. And then you said you're on the NuvaRing.
Mm-hmm.
Are there any other forms of birth control that you use?
Yeah, I usually have them wear a condom.
Okay, good. And then any history of STIs or anything?
Nope.
STIs, all right. Good. Have you ever been tested?
Yep.
All right, great. done with the personal questions for right now. We're going to move on to some of your family history. So I'm going to want to know a little bit about your grandparents, your parents, siblings, and you didn't have any pregnancies, so you don't have to worry about children or anything.
Cool.
So can you tell me about your maternal grandparents?
My maternal grandparents, they passed away before I was born. I would say one was 60 and one was 80. My maternal grandmother was 60 and my maternal grandfather was 80.
Okay. And do you know what they passed away from?
Grandmother was heart attack, I think, and my grandfather was like old age and he had really bad dementia.
Okay. How about your paternal grandparents?
So my paternal grandfather passed away when he was 75 of cancer, and my paternal grandmother is still alive. I would say she's around 70.
Right. How is she doing?
She's good.
Good.
Yeah, she has good health.
Okay, good.
No diabetes, nothing.
Well, that's great. Good. And then can you tell me about your parents?
Yeah, so I have a mother and a father. They're both alive. They're both 56. And they don't really have any chronic issues or anything like that, except my mom has hypertension, and she had breast cancer, which was caught on a mammogram, but she's 5 years free.
Oh, great.
And I think she's off her Coumadin for that.
Okay, great. That's good to hear. I'm glad they caught that early and everything.
Yeah, me too. Thank you.
And do you have any siblings?
Yeah, I have a brother who's 23.
Okay. And how is his health state?
In terms of like hospitalizations and stuff like that, he had his gallbladder removed.
Okay.
And he like suffers from mental illness and depression, but is not treated for it.
All right. And then, other than what you've already told me, I'm just going to go through a list to see if there's anything else that might have slipped your mind or anything.
Okay.
So just let me know if there is anything out of this list.
Okay.
So does your family have any history of diabetes, tuberculosis, heart disease, hypertension, pulmonary disease, strokes?
Nope.
Kidney disease?
Nope.
We did talk about cancers, headaches, any arthritis?
Nope.
How about anemias?
Nope.
Epilepsy?
Nope.
And substance abuse?
Nope.
All right, and we did talk about mental illness. So that seems to be everything about your family that I needed. So I just want to start off with asking some questions about yourself,
Okay.
just so I can get a background. Where were you born? City and the hospital, if you know it.
Hartford, Connecticut, at St. Francis Hospital.
Okay. And your date of birth?
1996, 1/4, so January 4th, 1996.
Okay. And what is your highest level of education?
So I've completed a bachelor's degree in health science, and I'm currently in a master's program.
Oh, nice. What are you going for?
Physician assistant.
Cool. So you're a student right now, but do you have any jobs that you're holding?
Yeah, during the school year, I work at the student union as a building manager, and when I go home, I work as a CNA.
Okay. And do you like your jobs? Do they bring any unwanted stress?
Yeah, I mean, you know, the typical stuff, like long shifts.
Typical, okay.
Yeah, but nothing that's unmanageable.
Sure. And if you ever do get to that point, just know you can talk to somebody about stress levels and time management and everything.
Awesome, thank you.
And are you married?
Nope.
Do you have a significant other?
Nope.
And so your living environment. You're at school right now, so do you have any roommates?
Yeah, I have 4 other roommates.
Okay. And then you all get along pretty well?
Yeah.
How about, do you feel like you have a good support system?
Yeah, we're all in the same program, so it's super
Okay.
helpful. We all know like what each other's going through, which is really good.
Sure, great. And then how about like your parents and your brother? Are they a good support system for you? Good. And then, so in the house that you're currently living in with your roommates, do you have steps in the house?
Yeah, I'm on the 3rd floor, so there's 2 flights of steps.
Okay. Do you know about how many that would be?
50 to 80, I would say.
50 to 80, all right. And then, do you have smoke detectors,
Yep.
carbon monoxide detectors, fire
Yep.
extinguishers?
Yep.
Okay, so safety measures.
Good.
Do you wear your seatbelt in the car?
Occasionally, yes.
Occasionally. Okay. And then, I know you're in school right now again, but can you tell me about your sleeping habits?
I would say it's a little bit more in the summer, but like when I'm in school, roughly like 7 hours a night.
Okay.
It's a little bit difficult to fall asleep initially, but once I'm asleep, I sleep through the night.
Good. Have you found anything that helps you to fall asleep?
Yeah, either if I like listen to music or like kind of like focus on my breathing, and like this sounds weird, but some days I like will think of a dream and then I'll like start dreaming to fall asleep.
All right. Well, whatever works for you is great. Is it restful sleep? You said you sleep through the night.
I would say it's a good sleep. I'm not restless or anything.
Okay, good. And then you touched on this a little bit, but your diet. How many meals a day would you say you eat?
I would say normally completely healthy 3.
Okay.
Ever since as the stomach pains progressed, my diet's also gotten weird. I eat the same stuff, but it's just more like my stomach's hurting, so I don't want to eat.
Okay. Is there a food that you've noticed that you normally like to eat that you can't right now?
Maybe more like fatty foods, but besides that.
Okay. And then are you still eating like fruits, vegetables, grains, getting your nice variety in there? All right, good. And how about your fluid intake every day?
I try to drink as much water as I can. I don't drink as much as I should. I would say maybe like 2 big water bottles full.
Okay. All right. And any caffeine?
Yeah, I have 2 cups of coffee a day.
Okay. And when do you have those cups of coffee?
1 in the morning and then 1 around 5.
All right. How about your experiences with alcohol?
I drink occasionally on the weekends.
Okay. And about how many drinks would you say you have?
I would say 5 drinks.
Okay. And then, what size cup do you drink out of?
I would say like an average size cup, maybe like this big.
All right. So, 8, 10 ounces?
Yeah, 8
ounces.
All
right, sure. And then, how about any experience with tobacco?
No.
No? Do you know anybody that smokes or anybody around you?
Nope.
All right. How about any medications we talked about, but are you taking any prescription medications that aren't yours or any illicit drugs?
No.
Okay. Have you ever had any experience with any illicit drugs?
No.
Okay. And then, so, in your free time, what do you like to do? Just what are your hobbies?
I like to exercise. I'm running a half marathon in November.
Oh, wow. Congrats.
Yeah, we'll see. I like hanging out with my friends and socializing.
Okay. And then, so when you're socializing, just sitting around talking and everything, it's relaxing for you?
Yes.
Okay, good. And then, what kind of exercise, like how many times a week do you exercise?
I would say I exercise 5 to 6 times a week.
Oh, wow. Great. Okay. And then, right now, I know you said you currently do not have a significant other, but these are just questions I ask everybody.
Okay.
And I just want to make sure that there's nothing going on.
Okay.
So, do you feel like you are around people that don't disrespect you? Like, you feel safe around the people that you hang out with?
Yeah.
All right, good. And within the past year, have you been hit, slapped, kicked, or otherwise physically hurt?
Nope.
And then if something like that ever would happen to you, God forbid, definitely something you can talk about. It is something I talk about with every patient, so you don't have to be worried about that at all.
Okay.
And then, in the last 2 weeks, have you ever felt down, depressed, or hopeless?
Nope.
And then, in the last 2 weeks, have you felt little pleasure in things that you used to enjoy or still do enjoy?
I've had less time to enjoy things just because I'm in school, but like I still like try to like when I'm having fun, stick to having fun. When I'm doing school, do school.
And then, what would you say your stress level is about right now?
I'm actually like pretty good, surprisingly. Maybe like a 7.
Okay.
very low 7.
Very low 7.
And I feel like I should be more stressed, but I'm not.